I'm Dr. Stephanie Morley, and thank you so much for having me here. I'm here to talk to you about our new device called the Vetlen Pouch, and I will hopefully not require the hook. So we are a veterinary-led 3-1 team. You're looking at the team here, and you're looking at the sales force right now. So I'll talk about this a little bit later, but we rely heavily on word-of-mouth marketing. We do that not just because it keeps our costs low and therefore keeps the cost of our product low. We also do that because as a veterinarian, I know the best way to hear about new products is from other people in the field. And so we rely heavily on case studies and word-of-mouth marketing. So I'm just going to go over, I'm horrible at following slides too. So this animated video is also on our website. The product is super simple to use. It's essentially a rate-controlled membrane in a pouch. It allows for passive diffusion of antibiotics, and it works over a concentration gradient. So you place the pouch within the wound, you exteriorize the catheter with the included trocar. You can use stay sutures in the eyelets that are there, depending on your wound if necessary. And you can cut that tube to any length you want. There's a barb that allows you to be able to attach a lure lock, so now you have your dosing mechanism. There's a couple suture wings in there too for tube management if you want to use it. You then dose with antibiotics. Any water-soluble antibiotic will effectively diffuse through the pouch. Most veterinarians have been using amikacin because it's a safer way to dose amikacin, and it's a less expensive way to dose amikacin because you're going to get all that drug right where it's needed. Every 24 hours, you empty the pouch of residual fluid because you'll get interstitial fluid moving in as drug moves out, and then you dose with fresh antibiotics. Unlike beads or other antibiotic-impregnated materials, if you get your culture back and you're using the wrong drug, you don't change the pouch, you just change the drug you're putting into it. It can stay in for up to 30 days, and when you're done, you completely empty it and you pull it out the exteriorization site just like you would a surgical train. And I talk too fast, so now the video is going to keep going. And I know it looks like a human and not an animal. The reason for that is this product's actually on its way through the FDA for human medicine. And I kind of have this nasty habit of finding products that are being made for human medicine and getting the veterinarians first. And so this company found me and I said, yes, I'll do that. That's also why our logo is a sheep, because they did their preclinical work in sheep. So it's being made to treat biofilm-related infections on orthopedic hardware and human medicine. And they directly compared a MRSA-infected plate being treated with a Vetlen pouch, Pergo pouch in that case, because that's the human company, with carrier beads and with systemic antibiotics, and the pouch outperformed either of those. So I thought it might be most effective to go through a few case studies for you. This was actually the first animal outside of the sheep that actually received the Vetlen pouch. It was a Fistulous Withers case. They had failed medical management for 4 weeks. She placed the pouch and dosed for 26 days. Cleared up the infection and the animal went back to work. And I can say a year later, it's still doing well. This was a really nasty laceration. More of the pictures on our website, it's really nasty. And I know everyone in here has got a wound where you're like, oh yeah, you've got one in mind. This one was interesting because they actually cast it over it and dosed for 14 days. And I was nervous for 14 days. And when they removed the cast and removed the pouch, it did really, really well. This was one that was more of a prophylactic use case, so it was an arthrodesis case, but it allowed them to be able to dose over that plate for 5 days post-op, which just added some security. But it has been used in other fracture-related cases where they were dosing directly over the orthopedic hardware. This one doesn't have any pretty pictures because one of the questions I always get is, can you put this in a joint? And I can say I have had at least one veterinarian who's gotten back to me and say, yes, they put it in a joint, they treated for 5 days, and they were really pleased with the outcome. So what's the next step? I do virtual lunch and learns, where essentially you bring your lunch and I'll come talk to you. Over a Teams call, it's a very short presentation. I'm super respectful of your time. I know how busy you are. So it can take as little as 10 minutes, as up to an hour, whatever you want. But I'll present some of this data and answer any questions anyone has. Like I said earlier, we have a Vouch for the Pouch program. That's essentially our way of trying to get case studies to help everybody else see just how this pouch can be effective. So if you give us a case study, super short amount of information, pictures, and a little bit of information about the case itself, we'll send you a free pouch. If you're prolific and you do that every week, I might eventually have to say I can't give you any more free pouches. But they're super valuable to us and to all of us because it's really, I call us the MacGyvers of medicine, right? We work with the tools we have in our toolkit. And this is just a new tool for your toolkit. And the best way to teach our whole ecosystem about how it can be used is to show them case studies. And then if you need any help, you have any questions, info@Vetlen is going to go to Angie, Christy, and me. So any questions, just reach out. We do have a booth in the main exhibit hall too. And our current show special is buy one, get one free with this promo code. Okay, thank you.